Welcome to Anatomy in Nutshell. In this video, we are going to see anatomy of the pericardium. Pericardium, peri means around, cardium means heart. It's a fibrous serous sac, lies within the middle mediastinum. It lies posterior to the sternum. Anteriorly, it's related to the body of the sternum, 2nd to 6th costal cartilages, and posteriorly, it's related to 5th to 8th thoracic vertebra. Coming to the development of the pericardium, the pericardial cavity lies in the dorsal aspect of the developing heart tubes. When the heart tube pushes the pericardial cavity, it forms a double layer serous pericardium around the heart tubes. So the subdivisions of the pericardium: outer fibrous layer, inner serous layer. The serous layer further divides into visceral layer and the parietal layer. So the fibrous pericardium, it is a strong sac adherent to the serous pericardium. It is conical in shape. So the cone has apex and the base. The apex fused with the outer coat of the great blood vessels. The base blend with the central tendon of the diaphragm. Anteriorly is related to the sternum and by the sternopericardial ligaments. Posteriorly with the principal bronchi and descending thoracic aorta and esophagus. So the apex blend with the tunica adventitial layer of the great blood vessels. The continuation of the parietal layer of the serous pericardium with the visceral layer of the pericardium near the great blood vessels. The base of the fibrous pericardium blend with the central tendon of the diaphragm. Coming to the relations of the pericardium, anteriorly is related to the anterior margin of the lungs and anterior wall of thorax. Posteriorly the principal bronchi, esophagus, aorta, thoracic duct, azygos and hemiazygos veins. Right and left side related to the phrenic nerve and pericardiophrenec vessels and mediastinal pleura. Inferiorly is related to the diaphragm, left lobe of the liver and fundus of the stomach. Coming to the function of the pericardium, it holds the heart in place and prevents the overfilling. The serous pericardium is a double layer, the outer parietal layer, inner visceral layer. The parietal pericardium lines the inner aspect of the fibrous pericardium, reflected as a visceral layer after reflecting around the great vessels. The nerve supplies the somatic nerve fibers. It's sensitive to pain. Developed from the somatopleuric layer of the mesoderm, the lateral plate mesoderm. Visceral pericardium closely applied to the heart. It develops from this planktopleuric layer of the lateral plate mesoderm. The nerve supply is autonomic nerves. It is insensitive to pain. The blood supply of the fibrous layer and the parietal layer of the serous pericardium are internal thoracic artery, musculophrenic artery and descending thoracic aorta. The visceral layer is supplied by the coronary arteries. The pericardial cavity between the parietal and visceral layer of the serous pericardium. The content is thin serous fluid. The function of the pericardium are it's to avoid friction during the movement of the heart. The contents of the pericardium are heart and its vessels and nerves, ascending aorta, pulmonary trunk, superior vena cava, inferior vena cava and the pulmonary veins. The sinuses of the pericardium, the two sinuses are there, transverse sinus and the oblique sinus. The transverse sinus anteriorly bounded by the ascending aorta and the pulmonary trunk, posteriorly by the superior vena cava and superior pulmonary veins. It lies between the arterial and venous ends of the heart tube. It develops due to the degeneration of the dorsal mesocardium. And we can see we can insert the fingers between the ascending aorta and the pulmonary trunk, the posteriorly the superior vena cava. The surgical importance of this transverse sinus is we can ligate the great vessels during the major cardiac surgeries. The oblique sinus lies behind the base of the heart. It is a J-shaped sheath of visceral layer of the serous pericardium. The function, it allows the distension of the left atrium during the return of the blood from the lungs. Boundaries of the oblique sinus: anteriorly the left atrium, posteriorly the parietal pericardium, right side right pulmonary veins, left side left pulmonary veins, superiorly the superior right and left pulmonary veins, inferiorly it is opened. The applied aspects of the pericardium: inflammation of the pericardium is called pericarditis. We can hear the pericardial friction rub. The fluid collection within the pericardium is called the pericardial effusion. In case of any breach in the major blood vessels, that is aortic dissection, The collection of the blood in the pericardial cavity is called the pericardial tamponade. We can see the money bag appearance in the X-ray, and we can tapping out of the fluid or the blood from the pericardial cavity is called pericardiocentesis. Two approaches are there, sternal approach and the subxiphoid approach. Sternal approach and the subxiphoid approach. Thank you. Watch more videos in the Anatomy in Nutshell channel. Subscribe Anatomy in Nutshell channel.